So good afternoon, dear professors, students, friends and fellows. On behalf of Jyoti Bhupad Mohta School of Health Science and Technology, IIT Guwahati, we welcome you all to join this invited lecture. So today our speaker is Professor Dr. Lieutenant General Ved Chaturvedi. Professor Ved Chaturvedi is one of the few qualified rheumatologists in the country. Moreover, he is the first DM qualified rheumatologist in Delhi. He received his DM from Delhi University in the year 1984, and also MD degree from Delhi University and DM degree from SGPG IMS Lucknow in 1991. He teaches and examines PG medical students in prestigious institutes like AIMS, GIMMARS and AFMS. He is senior most super specialist in rheumatology and clinical immunology in the Armed Force Hospital Research Referrals, New Delhi for 37 years. He recently joined Sri Ramganga Hospital's Department of Rheumatology. He received numerous awards and honors, including a few need to be mentioned. President Honorary Surgeons appointed by ex-President of India. Highest positions in the Army as a Lieutenant General after 35 years of service in the medical field. He received also PVMS and VMS in the country for pioneering work in the rheumatology and clinical immunology. Moreover, he recently also received Doctor of Science by Government of Uttarakhand. So with these short introductions, please join me to request Professor Chaturvedi to take over the stage to deliver his lectures.
Thanks, Professor. Thank you so much for a kind introduction. Friends, I'll keep things simple. I know this is a crowd which is non-doctors. Generally, most of us, we are speaking for doctors. But you must remember, if you keep things simple, whether you are a doctor crowd or a non-doctor crowd, that reminds me a story actually long back. Who has seen a movie, very famous movie, Mughal-e-Azam. Mughal-e-Azam was a very old classical movie. With the music director was a very famous person, Naushad. One day he found his own servant. He's singing, but not his song. He's singing somebody else's song. So he got very annoyed. So he started beating him. He says, you are working with me and you are singing for others. So he said, you make a very different, very difficult tune. That's why I don't sing your song. So all teaching has to be very, very simple. If some teacher makes things very complicated, probably he himself has not understood it. So I'll try to make it very simple. I was in army for many years. Now I'm working in Delhi, one of the private hospital, GANGARAM hospital. So this is my hospital. This is was an army hospital. This side, because I can't see there, and this is the GANGARAM hospital where I'm working. I'm basically a medical man. There are two streams in medicine. One is called a surgeon, another is called physician. So I'm basically a physician. So physician can be a cardiologist, can be a neurologist. I'm a rheumatologist, so I'll tell you what is a rheumatology. Now, not many people have understood, even doctors, about the importance of joint. So if you have joints, they will pain. If you have multiple joints, they will pain, and that science is called as rheumatology, or sometime in your own house we call it arthritis experts. So much work has been done in cardiology. Today, you must remember, I realize when my father had a heart attack and I used to read something about coronary, that was only, nobody knew that why suddenly person gets a chest pain and dies. It was just a presumption, imagination that maybe I think something is happening to the heart, and they start calling it heart attack. Can you imagine? That time there was no even X-ray. So that probably they thought something is going wrong in the heart. So they call it heart attack. After that, so much research has been done, which you also know and I also know. Almost people have reached not only what is wrong, they realize what is wrong at the almost at the gene level, what is happening. So a lot of research has been done in cardiology. Not much research probably. Yes, we did try for last about 100 years, about 60 years to be precise, that a lot of research has been done on the joint diseases. It's a very important for mobility. I can tell you, heart attack pain is just once. You will have just once and then you are okay whole life if you survive. But joint pains are lifelong, so it's a very important disease. It's a lifelong pain and it has to be researched, and people did research, and it's a painful condition. As I said, it's a lifelong pain. And what a mystery, I can tell you. I had a heart attack, I survived in my office, and now I am absolutely okay. But if I have a joint problem, probably then I may not be able to, so mobility issue. Basically, it affects your mobility. I always call it painful paralysis. So it's a painful paralysis, and I am very grateful to IIT Guwahati who gave me chance to speak here amongst the students. And of course, our topic is different. Our topic is what we can do together about the, and our goal is this. You have seen your parents or somebody, old people. You can imagine how painful it is to just stay at one place and you are dependent. So you require somebody to move you. So mobility is very, very important. I always use this word. It is not my this thing. They may not die. A heart attack, you will die probably. Some people die, some people survive. In arthritis, you don't die, but you vanish from society. I can tell you, I have seen, I'm moving in Delhi in those social circles, and suddenly I found somebody is not there, and they are the people who has arthritis. Suppose somebody's wife, why she is not come for this social function? No, she doesn't come because she has arthritis. So they vanish from society. You will find a person in the party, somebody has a cancer, he is there, somebody has diabetes, there, but arthritis patient probably, so they vanish from society. So this research is very, very important, and this research, the physicians are called as rheumatology. The science is called as rheumatology, and rheumatology deals with all these things like joint diseases, some muscle diseases, some diseases which we call as body framework. The body framework, suppose you take a framework of the body, so many things we deal with beside the joints, but for this crowd, just remember sufficient that we deal with the joint diseases, and joints are needed for mobility. So that is important. A lot of people say, Doctor, even if you ask a doctor, if you ring up a doctor in Delhi, I can tell you, if you ring 100 doctor in Guwahati, you just pick up, you can do a survey. Tomorrow you can do. Who's rheumatologist? If suppose I have a arthritis problem, which doctor I should go? So somebody might say that you go to orthopedic surgeon because of the lack of knowledge. Orthopedic surgeon is basically a surgeon to the joint. So if you need a surgery, you require a orthopedic. So he deals with trauma, he deals with fracture. While arthritis is a disease, it requires a diagnosis. Like you have a snake in this room. So first thing you need, whether it's a poisonous or non-poisonous, it's a cobra or non-cobra, that is decided by a specialist. So same thing as arthritis, that you decide whether this is a significant arthritis. There are 100 types of diseases which call arthritis. Arthritis means joint swelling. It has got 100 causes. So we are physician to the joint, while orthopedic is a surgeon to the joint. But our 90% patient still goes to the surgeon because people feel that orthopedic surgeons deal with arthritis. So that is how the development is. So first message to this crowd is, even if one person know, he will tell at least 100 more person that what is rheumatology. Rheumatology deals in the science for arthritis, and the orthopedic is the surgery. If you need a surgery, then you go there. This is how the joint is. It is something like you open the brain, and brain has many components, like your computer. You have open computer and then so same is the joint. Outside it looks like any joint, but it has many components which we call A, B, C, D. Name you forget about it. But now how to see these components? Now what we have ultrasound. Ultrasound goes inside sound waves. You can see some images, but they are imaging only. They are photos only. It's like that Apollo lands on the moon and sends image. So that is image only. That's why so much confusion. People say there's a water on the moon. Some people say there's no water on the moon. Seeing those images. Same as ultrasound. So they are actually images. It's not perfect. Same as MRI. So how to go inside and see? And if you go inside and see, that is in scopes. Like you must have seen, I am very sure one of us must have got it done, a scope in the mouth. That is called endoscopy. So see inside look, when I was trained in medicine, my professor will take a round, and suppose somebody is having a pain abdomen, he will just touch with the hand like this. And whatever he says, it is a gospel truth. That's all. Whether patient die or he'll say, so that is how it is. The science now doesn't accept this. Science wants proof. So then a scope came. It's not a professor's finger. He says it is possible that yes, could be stone, could be a cancer, could be ulcer, could be tuberculosis. So how to confirm? Put a scope and see, and take a little biopsy, a little tissue from that place and examine under microscope. So that is how so my job is to the peeping in the joint, and peeping in the joint by a scope is called as arthroscope. So basically I am going to discuss about arthroscope. So this is the one joint which has no swelling. This is swelling. Swelling is called arthritis. So we investigate these. I told you already about science of arthritis, and I told you about there are so many structures in the joint which is otherwise very difficult to see by either by ultrasound or by MRI. If you have a scope, you can see it, and you can see all these structures. It's not a new thing. It's a old thing. I organized this thing in 2000. This is 2003. In my own hospital, when I was in army, I was serving. It was very difficult to convince physician. Look, any job which is done by others, this peeping in the joint is called as arthroscopy. Now, arthroscopy is done very nicely by orthopedic surgeon, but basically they are using a bigger scope, and from that big scope they are passing a lot of instruments and they are fixing it. Like somebody, suppose a Pele, a football player, or a Tendulkar on a shoulder. Some joint has to be, something is broken inside, which we call it tendons, ligaments, ribbons, and you pass you see and fix it. That is a job of a surgeon. That is not my job. And they are using the scope for many years. It's not that. So they are using this scope for surgery. We are using it for different purpose, which I'll tell you. Like any joint, which I was explaining you, it is like this. Any joint is something like a football. So you have a football, and inside is a bladder. And that bladder is this. This is the bladder inside. And that bladder is called as synovium. Now, basically the synovium is affected, whether it is a tuberculosis, whether it's a cancer. So you might say it's a cancer of synovium, tuberculosis of synovium. But from outside it will look like swelling, so we say arthritis. So once you go to a doctor, the patient will come, Doctor Saab, I have a swelling. I say, okay, you have arthritis. But if you have a scope, you can put and see inside whether what is happening inside so that is the advantage of so when we did it, lot of physicians even today feel that probably I think it is job of a surgeon, it's not a job of a physician. So we went around the world and told people, no, you require a scope which is same scope, but you are not doing surgery. Basically, you are imaging. You go inside, and if you see if the synovium, particular part of synovium is affected, you can take the biopsy. So that was the major job, and then we showed it in our own conference. Our own people are more critics. So we have collected about 200, 300 people and showed to the people, and they also agreed, yes, we need it, but probably there is some conflict between surgeons and physicians. So we published also. So this publication was in 2004 in our own journal, which is called as Journal of Association of Physicians of India. It's a prestigious journal. It is read by 20,000 people, the members. So we published it, and the editorials also said that this is the Chaturvedi and colleagues reports their experience with arthroscopy in this issue. This is the first report of arthroscopy performed by a physician rheumatologist from India. So this is as late as 2004. So then I realized probably I am the only one who is doing this job. So that was the editorial, and then I again published it. That is in 2017. This is an international journal, and we call it medical arthroscopy. So a bit little different. A surgical arthroscopy, scopy, I told you, basically to go in that area which I cannot see normally. So you need scopes, whether it's inside the tummy or inside any cavity in the anatomy. So we published this in about 4 or 5 years back, and a lot of people. This gentleman is a very famous person who was associated with me. This gentleman is Patrick. He's another one who's trying to push in Europe. Okay, this is needed. Even Europe, it's not easy. Look, everywhere this human mind, this human machine is same, whether here or there. So it's very difficult to push this idea. And it looks like this. It's just arthroscopy. This is the joint, and since mouth has an opening, you can put a scope in the mouth. But how to put inside the joint? So you have to create a hole. So a small hole you have to create, and that is from that hole you can put a scope. This is a scope, and you must remember that whosoever is listening this broadcast, it is going to my doctors also, that it's not that it replaces the clinical skill. The clinician's mind remains the supreme. As robo, you are running robo, but who's the man behind the robo? Same is the arthroscope. So it doesn't replace the clinical skill. The doctors remain important, and he analyze the data that this is how. So this is, but it is an accurate way of peeping and reliable method of examining the joint. And this is an old video. You must remember, this is a video 25 years back. It's not downloaded from the net. I was there, and my patient, and first few scopes when we are doing it, I was also learning, and I was that time scared also. So I'll just show you that scope. Basically, this shows that you have a joint. Now joint is dark, so how to make it bright inside? So you need a light source. There should be a light source in that tunnel. So you need a light source. First thing, you require a hole. So you create a hole. Then for creating hole, you require anesthesia. So you anesthetize the skin. You put anesthesia. Put a small hole. Through that hole, you put a tunnel. That is a tunnel which is made of a good steel. Unfortunately, you will not believe, such a large country of 130 crore, we don't make arthroscope. Can you imagine? And we purchase for so much money. I inquired from a lot of people why it is like this. It looks so simple to make it, but I'll show you. So you make a tunnel, and from that tunnel you put a tube which we call sheath, and through that sheath you pass a camera. It has a camera on the tip, and that can be seen on a big screen. And if you see a suspected place, then you pass another small forceps and take a biopsy. That is how it is. So I'll just show you. It was a 1 hour video which I made it for hardly about 2 minutes. 2 minutes video, maybe less. So you will enjoy it, because yeah, this was made in Army Hospital. So it is. This was my department earlier, and it was a makeshift OT. It was not a proper OT. So this is about 25 years old video that one patient had made it given to me. And how you do it once you have a patient, and it doesn't require a general anesthesia. It just requires you clean the area like you clean for any procedure. And these are called, small holes are called as portals. So these are portals. These portals has to be made, any 1 or 2 portals. You clean this thing by any antiseptic, and this is a local anesthesia. So local anesthesia is called xylocaine. So you put the xylocaine, and once you have put anesthesia, and you want to put anesthesia inside the joint also. So this is the anesthesia which is put inside the joint, and this we call as bupivacaine. So there are 2 drugs. One is for inside, another is for skin. So I put the anesthesia inside, left the needle there, and this is, I put the fluid. The fluid will distend it, and then you put it out, distend, and then make a little hole. And once you make a small hole, from that hole you have to put this tube. Now this tube is called as sheath. This is a sheath, and you can put the water from there, which normal saline or something from there. It will go inside the joint and wash, and it will distend also. So you can see the water is going there and it is coming out from, it's a neat and clean. This is the scope, and this is the camera, and you can put through this, and once you are inside, then you can see on the screen the whole thing, because you have put the camera in, you have put the lens inside, and you can see through that. And this is a monitor what you can zoom, and this is the biopsy forceps which you can put, and you can take the biopsy if you suspect something, and you can take it out. This is how the scopy is done, and then you just remove it and don't stitch even. Just put a small this thing, and you can. So this is how it is done. Normally, once you have taken the biopsy, this biopsy, how it looks like under the microscope is, you can see a normal. You can say no, we is a normal. You can see no, it's a cancer. You can say it's a tuberculosis. So there are various names. This is not the crowd for discussing, but we call it A, B, C, D. So this is one type of arthritis which called as amyloid. This is another type of arthritis which we call as onchronosis. This is another type of arthritis which we call as hemochromatosis. And this is another type of arthritis which we call as pigmented villonodular synovitis. Now, that is not the aim here. The aim is that this is used, this whole scopy is used by surgeon for not for surgeon, they do surgery. We do this, we do the synovial documentation, like you see the image of the moon. So we see the image of the synovium, that football bladder, and then take the biopsy from there as you collect the sample from the moon. And it's used for the diagnostic, therapeutic applications and research purposes. So basically it's a new opportunities in research purposes. There are a lot of people who are interested, but hardly any. There are 4 or 5 people around the world, physicians, who are doing it. These are the instruments. Now these instruments are also important for you, because we are dependent on the industry to make it. So if somebody knows, this is what I was telling you, any cavity, if you want to peep inside, you need a light. So this is a light source, and light source is a cold light. If it is heating, then the live tissue will be affected. So it's a xenon light, cold light. So this is one which is required. Another is these instruments which I told you, once you make a hole, then you put this steel rod which you call sheath. So this is easy to make and nothing great in this. I'm very sure it is. This is just two inlet. So this is the sheath. From this sheath you put this thing which is actually scope. This is the on this tip there is a lens there and there is another lens there. On that lens you can put the you can mount the camera. So you can mount the camera on this, and there's a monitor, and of course this is to put the fluid inside, which we call it as fluid pump. You may not use it, you can use it simply. This is, of course, everybody knows about the monitor. That is a monitor, and whole thing has to be sterilized because you are using the human tissue. So basically you must have seen in the hospital this yellow fluid if you have gone to the hospital. This may be so this is used, we call it Sidex in our language. Otherwise you can use a chamber, this is called formalin chamber. You just put a small tablet of formalin. Now formalin, you must have gone to the anatomy dissection hall where dead bodies are there. They put a lot of formalin so that tissue is preserved. So formalin kills every bacteria, very powerful. So you put a formalin. Biggest problem with the formalin is it is a little smelly, while Sidex is this thing, but it's more powerful. But nowadays actually it is the UV light, and the first time when I used UV light, I didn't know about the UV light. So some patient of mine, he says, you don't use this, I'll put a UV light. So they put a UV light, and I was very happy. The first case I realized that patient developed infection in the eyes. So second patient also developed, third patient also developed. I said something is wrong in my OT, and I said, okay, let me see. So one day I stayed for about half an hour. I went early, and then I developed infection. So I said something, then I realized, oh, this UV light was putting the eyes for a longer time. It has to be. So what used to happen, that patient is driving, is wheeled in half an hour early before doctor comes. And the whole UV light is, it has to be covered. So before you learn a technology, you must know about the technology. But that nobody told me. So that is how I learn over a period of time. This is the scope which I was telling you, and this is the this is on distal tip. There is a high sapphire lens is used. Now this, if we can make it, and it's a leak proof lens. That is the, so basically arthroscope is this actually. Basically that tunnel is not a scope, it is a steel rod, but this is a scope which has a lens here and lens there. There are two system of lens, and the light source comes from here. So that is how it goes. And the basically optical lens system, which has a more of a engineering, you can have a thin or those lenses, rod lenses, and direction of view, you can have a 0 degree, 30 degree. That is okay. This depends on what you want to see. Light source, I told you. So light source is basically a 150 watt xenon and a fiber optic cable enclosed in a sheath. And irrigation system is a pump system, and you can use pump. Otherwise I was using even a human being for this thing because I was not very sure about it. It was a self learning for me. Nobody taught me, so I learned my own way. So if you learn your own way, sometimes you can be incorrect also, sometimes you develop your own. So this is my assistant who used to do it. So that is the why you want to put a lot of fluid inside, because you want to distend the cavity. If you distend the cavity, the folds become little parts so you can see it. So two things are required for seeing any cavity. First you have to put a lot of fluid inside so they become little. You can put gas also. So it become distended, and then you put the light. Then you can see the any cavity. So that is the how it is. And this is basically to make the hole. It's called, you can use any word. We call it obturator. Why we call obturator, I don't know. Why it is called obturator. We can always call it a bigger needle or something. And this is the camera which I was telling you. It is a solid state TV camera, and for the this is the system. Over that is the monitor for the, you can zoom and all. You can do that. It is a TV monitor, which we all know. This is a biopsy forceps. It taken biopsy. You must have seen skin biopsy at least. You take the biopsy of skin. So that is the skin biopsy. Same thing is. And this is how I was telling you. It is a the chemical uses glutaraldehyde, and the trade name is called Sidex. So in Sidex you put anything which is sterilized. So that's why you must have seen once you go to a compounder or nurses, they put in Sidex. But formalin chamber or some gases can also be used, ethylene oxides and all. They also a good this thing. Anesthesia, this is for doctors basically. Basically you don't require a general anesthesia or something. Most of the doctors think probably you require general anesthesia. You do require if you have a major surgery. If you're a local this thing, you just require for a skin you require xylocaine. The drug is called xylocaine. Inside the joint you require bupivacaine. Once you put bupivacaine, your joint remains pain free for 2 hours. 2 hours you can do whatever you feel like. So that is this is how the normal synovium looks like. It is something like if you bring a normal sampling from the moon, how it looks like. So this is the normal synovium, and how it becomes abnormal. We have a disease called rheumatoid arthritis. Now, it's not that you have to learn about rheumatoid arthritis. We call it in our language, we call gathia, vat is the word which we use Indians for this. It's called rheumatoid arthritis. So in rheumatoid arthritis, they become, they basically become edematous, large, club-shaped, huge thing. And if you see under the, you can see even bones, it has been eaten away, which we call it erosions. And if you see under the microscope, which they are multi-layered, and if you see this was a single layer, this was a single layer, and this becomes multi-layer. So this is a rheumatoid arthritis, and this is of course that before and after treatment we'll forget about it. This is another disease which is called osteoarthritis. This is a disease which is very common, those people who drinks more, and it's called rich man's disease. In fact, I still remember there was a minister, which I don't want to name. So he had this. So I said it's a rich man's disease called gout. So he said, I'm not a rich man, I'm a leftist. He was. He says, I don't have this. I said, I know. Other people also get it. So that is how this is a gout. You can see, peep inside a joint and see the crystals. This disease is very common in this country because of lifestyle changes. We are drinking more, we are relaxing more, we are eating more, food supply is more. So in army, it used to happen earlier with the generals, not with the Jawans. Now our Jawans get it more because the life has changed. Generals are not drinking. It is just, low people, they are eating more availability. So this is the gout. And this is another disease which we call it synovial chondromatosis. And this is a cancer this called synovial sarcoma. And this foreign body synovitis, amyloid, onchronosis, all those which I told you. So many things you can see. So what are the difficulties? Why I am presenting to you? This can be presented to doctors. The biggest difficulty, of course, this is part A, is for doctors, that basically it's a mindset of physicians and surgeon. Most of the physicians think it is not our job. This job of surgeon, why make a hole, I can tell you it is a very easy job, as you endoscope is done by physicians. Because why you require a physician to do it? If your mind does not know, your eye cannot see it. If you have put a scope and you have not seen what you are going to look, I'll send you in one room and there are many things. You will go and come back, and if I ask you what you have seen, you say I have seen many things lying there. But if I tell you, you just search for a red t-shirt, so everything will switch off. You will only see with a red sheet. So your mind should know what you are looking for. If you don't know, if you are not a trained rheumatologist, this is useless. So for surgeon, this is useless. For what is important for surgeon? He generally does the surgery through it. He fixes anything which is broken there. So that is a different job. It is the scope remains the same. It is something like you have a torch. Now torch can be used by a ENT surgeon. It can be used by thief also. The same tool is the same. So there are different uses of this thing. So same is the arthroscope. You can use by a physician. It can be used by the. Essentially, a mindset requires time, patience, experience. It's a fragile. It's a costly self-learning technique. I was very happy when I read this because I learned it. Nobody taught me. So it is self-learning and operator dependent. It depends on who is doing it. This is for you. This slide I made it yesterday, that basically existing scopes are big. So we want to make it smaller, which we call it needle arthroscope. No, it's not that we are the pioneers. It is already there. Australians started it, then they gave up. Probably market was not available. Today Americans are making it. Anthrax is the company. German, I think. German. So they are making it. And it's a large versus small. That's all. It is something like when I did my MD from Delhi University, I entered in Delhi University. There was a big room like this. What was that? That was a computer. A big whole bloody room, huge room was a computer. Now computer is this, a small computer. Same is mobile. I was traveling from, I still remember, I was traveling from Lucknow to Guwahati. I was posted in Changsari, you will not believe. First posting. I was just 21-year-old. I was posted in this pahad, this hills, as a captain. And that is the first time I came out of my medical college and I needed a job. So I landed and they said, you're going to Changsari. I changed 2 trains. In 3 days from Lucknow to this place, you come, then you change in New Bogaigaon. I'm very sure senior people may be knowing how we used to travel that time. That was air travel was not there. And so I was, next time when I was traveling, I was, for some reason, probably I was traveling to Calcutta, and suddenly so many, huge, about 50-60 girls, they entered in my compartment, and Ravi Shankar, that famous sitar, he was escorting them. And he said, look, our plane got little fall, this thing, so we have been given, please adjust us. So I was used to big phone, that army, big phone. And my wife was waiting for dinner. So I told him, look, this train is becoming late and I have to inform. He says, he took out a small phone from his pocket. He said, don't you use it? So this is the first time I saw the mobile phone. And that was 92, 93, something like that. And so I realized the technology, same technology which I am telling you, if somebody can do in this country, we are about 2,000 to 3,000 rheumatologists in this country, physician, which we want to use it. But we want a smaller, because bigger ones people are little scared. I'm using it and I still tell my friend use it. It's nothing great about using bigger ones also. But if you make it smaller, then I can give you a market of at least 3,000 rheumatologists ready-made. They will all purchase, because whosoever is listening, even a single rheumatologist listening, I can tell you, we are already putting needle in the joint. We are already putting an injection in the joint. For us, it's not great about putting a small, little bigger, but a little more bigger, probably people are scared. So basically, this is a large sheath, and this large has been made to put the instruments. We are not using instruments. If the surgeon uses instrument, we want a smaller one. So rheumatologists need a small sheath, as they need only for synovial biopsy, and large versus small is the game. So this is the large, which I told you. This is the small, which I want to use it. Another 4-5 slides and I finish it. That this is a needle arthroscopy, a revolution. It can be used even for joint surgery, and it is basically the difference, if you ask me, between the conventional. I don't want you to read this. Basically, it's a large versus small. That's all. So it's small, it is convenient to use. It is less traumatic. It will have less damage, easier to handle, is less costly. So that is all written there. So basically, you require, if you are using a conventional large one, it needs a larger incision, more damage to the tissue, and limited access. It is like driving a big truck, and if you're driving a scooty, you can go all around. So that is how the small, large versus small. So needle arthroscopy is coming world over. Very few companies are making. In fact, if I know hardly one or two in the world. No Indian companies, of course. We are not making large. We are not making small also. So we can do this because that is you have a ready-made market, and principles of needle arthroscopy basically is it has become smaller, and you can directly visualize it. You can reach. It's a more precise instrumentation, and it is a minimal incision and less tissue damage, and reduce swelling and bruising, and basically small, all those benefits of small, enhanced clarity, and sorry for I can't see small words, and wider field of view, and basically more targeted therapy and minimally invasive procedure, and less cost. Naturally, a big computer of this size when I did my thesis was so much costly. That was only one computer available in Delhi. Delhi University had, probably in the country, that was the only, and probably one was in IIT Bombay, if I remember. There was only 2 computers available in the country when I did my MD thesis. So it's a cost effective, and a lot of papers has been also done that yes, it is a early research and clinical trials has been done, and this is large versus small, which I already told you. This is a large one and this is a small one, and this is a small needles. I told you a lot of papers has been written. The smaller is better. We already know it. You don't require a great research to do it, but science requires papers, so they put papers also. The needle arthroscopy is, if you compare, then it is a basically much easier if you compare. So these are the comparisons. So this is the last 2 slides, that scopes are here to stay to reach difficult areas of human anatomy. If you want to put inside a scope in the ear, you can put a scope in the ear. You can see the middle ear cavity. You can see in the whole screen. You can put a scope in the nose. You can put a scope in the mouth, vagina. You can put in the rectum. You can see it. So that has helped the surgeon. Without cutting it, you are going inside and seeing it. Conventional joint scopes, if you don't want to use the word arthroscopy, looks a little difficult. It's called joint scopes, are larger diameter. Needle size scopes are already there, and we know the advantage which I told you. Can Indian do it to capture ready-made market? Ready-made market is available world over, not here. I was vice president of today. I'm deputy general secretary of the APLAR. It's a Asia Pacific body. Asia Pacific body, about 30 countries, is starting from Australia to the Middle East, all over, all Southeast Asia. When I presented my work in 2005 in Malaysia, even that time there was not a single physician or rheumatologist doing arthroscopy. So we have about 15,000 rheumatologists in this area, roughly. And China, such a big country, Australia, Middle East, and there's a ready-made market for a arthroscope, and somebody makes it. Indians can do it. If we really want, we can do it. I'm very sure it is a simple procedure. It is just probably we didn't realize the potential value of market. Maybe Chinese will realize, and maybe they will make it faster than. But if we do it, it will be. Yes, we did climb few stairs, but the whole Brahman is quite big. I did little bit. You contribute you are a youngster. You are a more fertile brain. You have more fertile ideas. You might come with a simple solution. Why don't you like to do this? Why you want to do so much? So most likely more youngsters are involved. If they are involved, we can do that. And it's pure engineering. There's no medicine involved in that. Medicine, I told you, I just want a cavity, light, and something go inside, take the picture, and if I feel if this picture is little faulty, I call it synovial documentation. Means I document different areas, like you document different areas of moon, and if you feel suspected, you take the biopsy from there. So I think let's join and I have some vision. Let's see if I can. Let's not have a small vision. Let's have a bigger vision that we can do it. Thank you so much. Thanks. I'll be happy if you ask me a very basic question also. Basic question. If I am in the crowd, I'll ask. If I am the student, I'll ask. Tell me why for so many years a smaller scope could not be made, and why you want a bigger smaller scope. If the bigger scope is no problem, I am doing bigger scope. There's no issue. Probably the answer to that is probably it is not acceptable by physician, because they always feel नहीं यार वो इतना उसमें थोड़ा होल बनाना पड़ेगा, bleeding. Nothing happens. You don't require a stitch even for bigger also. For a smaller, of course, then thing will be required, and there is a ready-made market for this. And next time when I come, I'll put you another idea about rheumatology. If I come maybe after 1 year, which is a very bright idea which I wanted to do. I joined as a lieutenant in Changsari in this village only, and then became lieutenant, major, brigadier, major general, lieutenant general, and became the director general. So all 200 hospitals of Indian Army was under me, and I can tell you, only 1% does it. Don't wait that no यार कोई और करेगा, कोई नहीं करेगा. You will do it. One single person will do it, and it will change the life. Whether you take any science, you take mobile, 100 people have not done it. It is one person has done it. So I request if one person take this system, and we can do it. So that is from my side. If you have, we have about 5-10 minutes we can interact. Or I can start from here. There is a better way. There is my professor used to do. When nobody speaks, then he'll say, okay, you speak. So we start from number 1. Anything. I'll not bore you. Another 10 minutes we finish up. Yeah. Yeah, please.
Sir, from the point of view which you showed right now, that physicians generally put the needle inside and check whether there is some abnormality, or they check the biopsy regarding the same. But I have a question, like after that what you do, and how do you separate arthroscopy with terms of physicians and surgeons? Like basically surgeons are also cutting the joints and taking care of that part, right?
No, a joint is not that simple as I showed you. Joint is more complicated, and that complexity, in fact, orthopedic surgeons know better than us. Now, what happens? Suppose you are playing football, or you are making this, or you are using a ball. Then a lot of ligaments are used, and that ligaments are broken. Then once you put a scope, then you realize that is broken, that is stitched. It looks very simple, but it's a very complex procedure. That is called joint surgery. Now that you can do openly, you open the joint and do it, or you can do by scope. So scope remains the same, but this scope is used for surgery by surgeons. We don't do it. We only do one job from there, that we just visualize the surface of the moon, that is surface of the joint, which is called as synovium, and if we suspect a suspicious looking tissue, we take a biopsy. It means there are 2 types of diseases. One is surgical diseases, which is generally injury. Another medical diseases. We deal with medical diseases, and medical diseases generally affects the synovium. So that's why you need a biopsy for that age. It's not that it will diagnose everything, but that will certainly add to the. I ask you as an engineer, what is it? What is the problem? Why can't we make it? Suppose I am asking you a question. Forget about you asking me a question. You tell me why, as an engineer, you can't make it. Anybody? Especially the youngsters, why we can't? Look, I'm absolutely a novice. I always feel, what is so great about making this is you just require a steel tube and another camera, and on that camera is mounted probably a lens to magnify the tissue. That's all. So I really don't know why we can't do it. Maybe we can't make a leak proof because it's a live tissue. Maybe somebody has put in our mind, Americans and Europeans, that you don't touch it because it's too sensitive. It's live tissue. I don't think so. It's a very robust kind of this thing. Our body is not that fragile. You can do a lot of things with our body without hurting it. There are a lot of doctors inside your body. Believe me, beside us, there are a lot of doctors inside your body which heals you, not us. So you don't worry about that. In the sense, there are thousands of doctors inside your body which we call as immune system. You eat everything, samosa, kachori, this, that, everything you eat it, you become healthy the next day. So that is because of the doctors inside. So even these needles and all, maybe government regulation, I don't know. I'll ask you from electricals, Professor, maybe the government regulation stops us or what? Making anything, not only scope, so many things probably most of the medical instruments are not made in the country. You'll be surprised. We are not making ultrasound. You know how many ultrasound machine we are selling in the country? By the way, I'm one of the few physician, rheumatologists who are using ultrasound. I was the first one in the country to use the ultrasound for the joints. So I have another story to tell sometime. So when we use ultrasound, I say, what is so great about ultrasound? But when I ask people, why can't we make it ultrasound? Because ultrasound, even Guwahati must be having at least 200 ultrasound machine. So whole country, you can imagine, so much big market, and we are not making ultrasound machine. Why we don't make it? I also don't know. Why? Maybe not be cost effective. Maybe technology is too difficult to get. Maybe that zeal is not there with us. Maybe there are more profitable things than making this. Maybe it is licensing and government regulations making it difficult. Maybe you have not realized the potential of medical market. Probably medical market is one of the biggest market in this country today, and whole world is coming to India for treatment. Because Indian doctors are good, by the way. I must tell you that. Indian doctors are good. Indian system is affordable. It is still affordable. Medical education still is a very regimented education. Means it is taught still with the same stick, and if you don't learn, then you are out of the class, because that is how the medical education. Of course, all educations are being diluted. Leave aside IIT and all, they are a different class. Most of the medical education suffering because of the privatization and so many, which probably you know better than me. But I am from that school. I still feel that probably the medical education in this country is still very good, and only thing it doesn't have a support. Our pharmacy industry is very good, sir. We are making so many drugs, you will not believe. We call it biologics. Now biologics cost this much, lakhs of it. You fall sick, you will be surprised that you will sell your house. But now biologics, we are making it for last 20 years, and we have made it so cheaper. I was the first one in the country to use biologics, and one vial used to cost about 1 lakh of rupees. So since I was in army, people used to say you are in army hospital, that's why you're using it. Now whole country is using it because of what we call made in India. So that concept, and today those biologics, I still remember whenever I used to go to US, people used to say Indians can never make it. But now we are making. So we have capability. Probably we have capability. We don't have organization. Thank you so much. Thanks. Thank you, sir.
So, do you have still any questions, students, young students? I think you should have some questions.
I'm ready. My
Correct?
flight is tomorrow only. I'm calling.
I think you should have some questions. You? Do you have any questions? So if you do not have asked the question, that means you do not understand anything actually. That is kind of logic you used to say. If you understand something, then you have many questions popping up in your mind. So if you don't have any question, I just want to ask one question, Professor. So if the technique, just sit said, no need to. So the thing is that this is the technique we are talking about, the kind of invasive way of, if I understand correctly, kind of diagnosis basically. So have a documentations, invasive.
correct.
So invasive way, so that we have a kind of documentations, basically imaging in our biological terms. I am biologist, we talk about the imaging of different tissue inside this synovial fluid basically, and then based on the documentations, giving the idea whether there is kind of different kind of arthritis disease. So
I'll explain a very simple way. Suppose today I have a skin disease. Now what happens? You go to a skin specialist. How he diagnose? He has an atlas. If it looks like this, this is this. If it looks like this, this. And if he can't diagnose it, then he take a small piece. That's called biopsy. Now skin is outside. Suppose the skin was inside, then he has to use a scope to take the. So that is how the simple. So basically a thing which is not outside, it is inside. Only thing against all these methods are their invasive.
yes.
And nobody wants. Suppose somebody tells, look, I will put a scope in your joint. I say, no, thank you, I don't want it.
That's the thing I have to say.
So that's why you want a smaller scope. Today patient is educated. If you explain to him, look, I'll put such a big rod in your mouth, he says, no, thank you, I don't want. I want if you show him a very lean and smart that and introduce to somebody who has already gone, he said, no, nothing happens, don't worry. So that, like today, I was having a lot of pain. I'm staying in AIMS, so I said I must get a MRI because in Delhi is so busy. Even if I think today I'll get chance after 1 year to do it. By the time either I'll become. So I said let's do in Guwahati. So I got a MRI done. No, MRI nobody is scared generally because people say okay, there's nothing invasive about it. So he said about invasive thing. Invasive, everybody, all of what we want say little safer, but that is the. If I feel we require a little zeal to do that, both doctors. Probably we should be also demanding. We have never demanded, neither the government or that our one of the IITs can take this issue of the making it. Is it a priority for the government? It's not a priority. There are a lot of other priorities. I was just seeing a poster, a drone. Yeah, there are priorities for the government. This is not a priority. But this much I can tell you, this is a big market is available for you. This information I must give you that is there. Market is there, rheumatologists are there, need is there, science is there. It's not a fake, it's not a commerce. The science is there. With the science comes commerce also. But probably people are not sitting together. We don't have organization skill like Europeans. They have more. He thinks he wants. He asks. Suppose he asks me, doctor, what you want? I'll say I want something like this. So then he thinks. So we are not sitting together probably. That's why so many things we could not make it probably. And maybe things which are available from outside are cheaper. They are producing cheaper. But it is not that. I always tell people you should be proud of your medical and pharma industry. The days are not far. If we don't protect this, it will be very costly. Today to fall sick in US is a curse. You can get everything, you can't get a doctor. I went to Canada to see that fall, Niagara Fall, and me and my wife, we stayed with one of the student. So I said, you have lost so much weight. She was a PhD student. She says, look, I'm having fever for last 2-3 months. I say, you are working in the best hospital. That is the hospital which coined the term cancer. This is the hospital. What is that city which is which has a Niagara Fall on the border. The city is, it's not coming to my mind. So that city, the hospital name is on that city. This side of US side of the uh, Buffalo. So it's called Buffalo General Hospital. Now, who made the term cancer? It's the Buffalo General Hospital. Rheumatic heart. That hospital, she was working, and she was having fever for 3 months. So I just stood. I just told her, look here, and I did it like this. So there were lymph nodes. I said, this is tuberculosis. You are Indian. 3 months fever, glands, most likely diagnosed tuberculosis. Next was diagnosis cancer, but 99% tuberculosis. So he said, Manka, why could not show? Because of the insurance issue. If students get an insurance of $3,000, if you have 3,000 policy, your number will come after 6 months. You may die. So what a great system. Absolutely a rubbish system, should be called rubbish only. So we have a good system. If you fall sick, if your number does not come tomorrow, day after tomorrow, you will certainly get a doctor. So so you have a very good pharmacy system also. We are making our own drugs. That's why drugs are cheaper. And the days are not far. So let's join together. It's for the human cause. It's not for medicine or surgery. It is cause for our children, our parents. That medicine should be cheaper. Whole life I worked in a government sector. I realized the importance of the cheaper medicine. And now I'm working in a private hospital. So I realized the problem which can happen to this if we don't have a. In fact, we should always tell government, if you make one private hospital, you must give a land to a government hospital in front of it. 2 hospitals together. You cannot make a private hospital unless you have a government. That is what my view is. Because you will have rich people also. Let them pay if they can pay. But there are poor people also. They should not die without medicine. We should all work for anything which we can do it for the humanity. It's not only medicine, it's not only the surgery where you can see electricity that time not there. I still remember when I was in Chingsai, there was no electricity. I used to carry a lantern coming from the hill down to the officers' mess, because Changsari was considered a field area. It was considered jungle. And in army it is written, if you have light, then it is a peace area. So what was happening? There was a light in Guwahati, but there was no light in Changsari, because it was purposely kept as a field area. So I stayed for 3 years in those conditions.
Good. Any more questions? You have any questions? So then hopefully you understand, and also one good things are in your school also. Our department actually have mixed students. Some of them engineering students from diverse background, mechanical, electricals, many things, and also biology students. So they have actually very good combination.
You require a doctor, you don't require an engineer, you require a bright person in any field to make it.
Yeah.
I can give you hundreds of stories which people they have not studied science, they have made. You are lucky that you are studying such a great institute like IITs, which is facilities there. You are in a good company. If one person does not understand, another person can tell you. So you are lucky, but it's not. You just requires, probably the biggest factor requires motivation, which I feel. If you have motivation, you can create a thing. And anything. You want to write a book, if you have motivation, you can write a book. You want to direct a drama, you have motivation, then you will suddenly realize, I can do this job also. So that is there in this, and that is whatever history, that's a different lecture altogether about I came from a small town, and in army, I have not seen an army officer except in movies. So when I joined army, I didn't know ABCD about army. But army treated me well. I became almost the highest position in my medical, whatever I could achieve. So probably everything is not lost in this country, which we feel na yaar ye to country gadar hai, hum to bahar hi jayenge. Welcome, you must go outside, because we have seen world. Once you have seen the world, then you started realizing that our country is not that bad. I can tell you, you must see the world. You must work outside. You must earn money also. Money is important. But then once you earn everything, then you realize, come back, that our country is also very good. And so many fields which we don't realize. As I tell always my patient about the pharma industry. our pharma industry, they are chemical engineers? What are they? Those?
Pharmaceutical, chemical, chemist.
What are those who are working, those scientists in pharma industry? Well, fantastic job they are doing. They may be copying. They say, no, we copy. So, somebody is doing original, somebody is making jalebi. But I also copy making jalebi. So you can blame me. You can say it's non-generic. It is biosimilar. It's not this thing. When we start making biologics, 1 lakh rupees for one vial. Now we are making for 4,000 rupees for one vial. Because initially, and I still remember those in those Europe I went and there were a lot of fight. They say, no, you can't make it. It is too complex. Then say, okay, even if you can make it, then it is not exactly similar, so we will call it biosimilar. We will not call it. They start call it biosimilar. So now they are purchasing from us. They say, no, we want biosimilar because cheaper. So that is how these things. So this arthroscope, which is costing almost about 70-80 lakhs, probably it can be produced in just about.
ट्राई नहीं किया होगा
ट्राई नहीं किया बस किसी ने ट्राई नहीं किया इसलिए नहीं बना आई एम वेरी श्योर दिस इज द वर्ड फॉर दिस कंट्री वी कैन डू इट वी हैव नॉट ट्राइड इट दैट्स ऑल एंड if you try make it I will give you the first order of at least 500 this is which I can tell you ready-made orders from my organization Indian Rheumatology Association which they want it and even Asia Pacific we can explore the possibility in Asia, which is IIT Guwahati, one of my cousin son, he is in US today, he is studying for the first or second batch, IIT Guwahati. IIT Guwahati has a good name, good place, you are working and I am very sure, never feel that other person is great or something, nobody is great, I have seen, all of us, you are the Param Brahma, whatever say, you are the person, you are the best. Thanks.
Okay, let's thank Professor.
So one
Yeah. So can I take one photo?
one photo
Yeah. Documentation is also important. Photograph. You must take a photograph. And a lot of people say we don't document Indians. We do. We make jalebi, but somebody else will publish it. It has happened. So many things. Somebody makes it. And somebody publish it and then he becomes specialist in that field. That he is the one who has published the paper on jalebi. Yeah. No, I can tell my own distinct story about biologics. I use the maximum biologics in the country. But publication was done by somebody else.